Three, two, one. All right. Hello, everybody. Wow, I'm really in the red on that microphone. Okay, sorry, I had to back up a little bit. All right. Today we're going to be talking about vampire facial, and we're going to do a little explanation. I'm going to try to use visual aids as best I can. We own a medical practice, specifically a medical spa here in West Palm Beach. If you're watching this video, you've probably watched other videos that myself or Dr. Jen has put online. So basically today we wanted to do more of like a podcast style because there's a lot of information. And then if you don't want to listen to the sciencey, nerdy, all the science behind the procedure, if you don't want to listen to any of that, you can go ahead and skip forward a few minutes until you actually see the video, because I'm gonna get in the chair, and Dr. Jen is going to do the procedure. She's going to do it on me, and we're just going to record the whole thing so you guys can see exactly what it is that the procedure entails. First thing I think we want to address is the first picture that I just showed of Kim Kardashian with all the blood all over her face. It grabs a lot of attention, but there's not any merit to that. Those are red blood cells, which are completely useless to this process. They typically go right in the trash when after the blood is finished centrifuged, you just throw them out. So, I don't know, I guess it was just for effect because the plasma that we're actually using for the procedure is just a light yellow tinted color. It doesn't stand out like the blood does. So I don't know, maybe that was just for Instagram hits or Twitter likes or whatever. But anyway, you don't look like that after the procedure at all. Most people can't really tell that you've had anything done. Even immediately after, you're like slightly rosy. You look like you have like half a sunburn. I mean, it's not bad at all. And then we're going to talk about if it hurts. You guys are going to actually watch me get it done here in a couple of minutes. And I'll let you know the whole time, like where, how much pain's involved, if it hurts at all, which I've had it. This will be my third one. So, and I'm working on my acne scars. And then we'll do some before and after pictures. So stay tuned for those. You can always check out our blog. We do most of our research is on our blog. So that's at drjenpb.com, drjennpb.com. So anyway, all right. So I'm gonna welcome the doctor in on this one. So hey, say hi, doctor.
Hey Zach, this is Dr. Jen. I'm just going to go through some of the vampire facial basics. Starting off, kind of have to know the process of aging and the layers of the skin to know how the vampire facial works and what's involved. So, the younger your skin is, the more plump it looks. And so a lot of times older skin, people are not sure what gives them the older look, and it's not really, skin's quote-unquote sagging, we hear a lot. It's actually loss of volume underneath, and what specifically is lost is collagen, which is created by fibroblasts and some other cells. But so our first layer of our skin is the epidermis, and then we have a basal layer of our epidermis, which separates the epidermis from the dermis. And in this picture, you can see the darker tan pink color at the top is your epidermis. The thin line between the darker pink and the lighter pink is your basal layer, which separates your epidermis and dermis. And then your dermis in this picture is the areas with all the stuff going on. And in the stuff, you can see the darker lines are your collagen. The area between the darker lines is the hyaluronic acid, which actually holds water. So when we get fillers put in, it's hyaluronic acid that gets put in. So it's a gel-type material that holds water and deteriorates over time, which is every 9 months to a year you have to get more filler put in. And then in the skin is also elastin. So when you're younger and you pinch your skin, it bounces right back. The older you get, you pinch your skin, it takes longer for it to bounce back. And then your collagen, like I said, is the framework where everything sits. So when you lose collagen over time, which is about 1% a year, you end up losing elastin, and you end up losing the structure of the framework that everything sits. So collagen's kind of the main thing under your skin that gives it its buoyancy, gives you the youthful appearance. And then underneath that, you can see the blood vessels, the red and blue with the fat underneath, and that's your subdermal area. And of course, the more collagen we lose, the more elastin we lose, the more easy it is for our skin to wrinkle, because those muscles push the skin back and forth and create lines and wrinkles over time. So that's just the basics about getting older and what happens underneath the surface of the skin that causes the aging look. So now I guess getting in more to the microneedling part of it.
Yeah. So how does microneedling? Basically, what everybody wants to know is how does microneedling? Is it going to make me look younger? And is it expensive? And why? What's the big deal with? What makes a vampire facial a vampire facial? You know what I mean? Like, that's what people want to know. You got to kind of think, like, we want to explain this to people in the way that, like, if they're completely lay person to the medical community at all,
Okay.
They have no idea what a vampire facial, they may think that, it involves like drinking their own blood or something,
It's funny, we've actually had people ask that if it involves them drinking their own blood. Absolutely not. No, the vampire coined term was done by Dr. Reynolds. He did all the research and the background needed to do these procedures. So for anyone to do these vampire procedures, you have to train under him specifically and use his protocols. I can't say the validity or the science behind anyone else's PRP therapy, as you might hear it, but I know his is proven, and that's why you have to train under him to use the coined term vampire. But vampire comes from actually using your own blood as a treatment method. So that's where the name vampire gets. Nothing to do with ingesting blood. It's just we take blood out of your arm like you would if you're giving blood, or going to the doctor and just need to take some blood. And we spin it down, take out the red blood cells, which I'll go into a little more depth later, but take those out, throw them away. We're left with platelet-rich plasma, which is, in this case, the vampire facial. You microneedle it into the skin and the face, and you end up having the younger, youthful appearance because your body naturally comes back to the collagen-filled skin it had when you were younger.
Okay, so these platelets act kind of similar to maybe like a stem cell, you could say.
Very similar. So platelets, just get in microneedling, or the PRP therapy. So after we take the blood, we use a centrifuge and spin it, and it just takes your blood and spins it really fast. And then heavier material just from the centrifugal force gets pushed to the bottom. And so all your red blood cells go to the bottom of the tube. We take out...
Hold on. So Dr. Jen made me this juice. This is like the healthiest tasting thing I think I've ever put in my body. I'm going to put a picture of this juice up right now. What's in this juice?
Kale, bok choy, 1 apple, cucumber, turmeric, ginger.
That's it?
Lots of kale. Lots and lots of kale.
But don't you grow your own wheatgrass?
Oh, and wheatgrass. Yes, there's a lot of wheatgrass in this one.
I think that's what I taste is the wheatgrass.
Definitely has a
Is
kick.
wheatgrass really healthy, or is it like... Because
all the research...
All right, I know, like, kind of like the yuppie, like, oh, I'll take a shot of wheatgrass. And, like, that was a thing years ago, and you don't really hear about it too much anymore because it kind of fizzled out because nobody likes drinking wheatgrass. But, I mean, is there merit behind that? Like, is there coming from a doctor, like, would you tell somebody like it's gonna help you if you drink wheatgrass a couple times a week? Like, is it really that healthy?
Well, everything I've researched on different greens for juicing, wheatgrass is among the best. The chlorophyll in it and all the processes it uses is more efficient than most of the other vegetables that we intake.
Mm-hmm.
So since we don't sit down and eat a bowl of wheatgrass, it's one of the best things that we can juice because it's not necessarily tasty to eat. So
Right.
no, it has a lot of great value to it, and it also gives you energy. I can tell when I haven't juiced. I just don't have the spunk.
You know what
have.
You know what I feel like when I took the first sip of this was like black espresso. That first sip when you don't realize there's no sugar or anything in it, and it's just like almost like locked my neck up, you know?
Definitely a drink that you remember real quick that you don't drink it for the taste.
Yeah,
you drink
right.
it for the well-being.
All right. So anyway, so
Going back to PRP.
Dr. Jen's Juice,
Yes.
side company. That's going to be a side company. Dr. Jen's Juices.
I like my juice.
Yeah, look for that. Look for that company. Next 10 years. Next 10 years, Dr. Jen's Juice.
Has to be delivered in the first 10 minutes.
So, all right. So anyway, so this vampire facial. So how to PR? Let's just make this simple. How does platelet-rich plasma make me look younger?
All right.
How does microneedling platelet-rich plasma into my skin make me look younger?
Yeah, you asked that question like it's an easy question. It's multifold. There's the process of microneedling, which by itself helps, and then there's the PRP we add on top of it, which alone helps as well. So when we combine the two, it's exponential. So PRP, when we fall down and skin our knee, we kind of get that yellow goo, which I've said on my other videos, so I apologize if you're hearing this again, but the yellow goo that comes out on your knee after you skin it is our platelets coming out, doing what they do. And you touched on like the stem factor relationship with platelets.
Right.
It's kind of a hot topic, so we don't like to bring in stem cells just because there's a lot of regulation and stuff. So, but when you
I just meant for explanation purposes.
No, I know.
They act kind of similar.
They're very similar.
Like, to explain it to a layperson, nobody knows what the heck a platelet is, who didn't go to medical school more often than not, unless you're like a pharmaceutical rep selling centrifuge machines or something.
Right.
But most people know what a stem cell is, or just have a general idea of at least what it does. Like, okay, it's a base cell that can turn into other types of cells.
So
you know what I mean? Like, and helps to repair things. That's what they know. They know that, like, before I got into this, that's what I thought. My general conception of a stem cell was it's used to help repair things. Like, if I put it in, my shoulder, it's going to turn into shoulder cells or something. You know what I mean? Like, that's the lay person's, like, we don't know what the heck is really going on. It's just, so.
Yeah, no, going back to, like, when you skin your knee, that yellow goo, what's going there is your platelets. That's a whole
piece of wheatgrass.
That was a piece of wheatgrass.
That was an entire piece of wheatgrass that I just drank.
Okay. All right, so the yellow goo comes out, and its entire purpose is to cover the area and clot it, which everybody knows, or most people know that's what platelets do. Their major job is clotting. But their other job is whenever you have an injury, you need to fix that area that's injured. And so, it uses something called chemotaxis, which is where it sends out chemicals to get other cells involved and help repairing the area. So platelets come to that area, and that initial burn that you feel, like if you skin your knee or hurt yourself, that's the platelets coming in doing what they do. It's not actually the injury, although that can cause some of the pain. The burn is actually disgusting. Is from the platelets coming in. So the platelets give off various chemotactic factors, like there's fibroblast growth factor, there's platelet-derived growth factor, VEGF. All these are different agents that go out and say, hey, we need to create cell growth, we need to create new vascularity, we need to create new epithelial cells, collagen production. And so platelets are kind of the organizer of tissue damage. When there's damage, it organizes how it's going to fix it. And so, if you have a scar or if you have lack of collagen, just from normal aging, it goes in there and it's saying, hey, let's fix this area. Let's create more collagen that was once here. And so that's what it does. FGF is the chemotactic factor that causes collagen production. So there's a lot of people out there, we get this all the time, where people are, I really don't want to do filler, but I'd like a more youthful appearance. So this is a good option for that. Is it instant? Absolutely not. The only thing that's going to be instant is something that we put in our bodies that's not necessarily natural, such as fillers. There's just no way around that. Your body has to actually create the collagen. We have to wait for fibroblasts to get in there and do their job. So that takes time. It's a maintenance thing.
So this isn't something that's going to take effect overnight.
No, absolutely not.
I mean, it does take effect. It's just you can't see it. You can't see the visible effects.
You can't see
for
it.
A few months.
Right.
Yeah.
So that's the role of the PRP. Now on the other side is microneedling. That by itself is helpful. The whole process, and it's the same growth factors that we've been talking about, the VEGF, the FGF, the PDGF. It's just not as efficient because we're not putting your platelets back in. But the microneedling, it's this little pin, and we go over your skin, and there's a lot of people who ask, number one question, does it hurt? It does not. I know.
Well, you don't even have to talk about it because they're going to watch me get it done.
That's true. You
guys are going to watch me get it done in a couple of minutes, and
But no, this needle, it just barely punctures.
I think it's 9.
9.
It's 9 needles.
Right, it barely punctures your skin, and all we're looking for is a rosy color and like small little droplet of blood that goes away before we're even done. Can't even tell it was there. It's just what we're looking for, and that little micro injury does the same thing. Your body sees a micro injury and it says, oh, we're hurt. It calls in platelets, and it calls in the platelets to do their growth factors just like it would if we injected it. But the only difference is you don't have the abundance as if we do PRP on top and then microneedle that into your skin.
And the reason that we're microneedling the PRP in, there's a lot of science behind it. It's not just like, we didn't just decide one day that, we've got some leftover PRP from a vampire facelift, which involves actual injections of syringes filled with PRP. We didn't just decide like, let's just go ahead and drip this stuff on somebody's face and microneedle it in. It's the science behind it kind of works the same as the same reason why tattoos work, right? A lot of people that don't have tattoos don't realize, and me and Dr. Jen have many tattoos. So a lot of people don't realize that tattoo needle isn't hollow. It's not a hollow needle. There's no tube of ink inside a tattoo needle. And before I had tattoos, I actually thought that there was, like, the ink was getting injected. I didn't realize that the ink just rides on the outside of the needle, and that's how it goes in. You know what I mean? Like, yeah, that's why they dip it into a little cup full of ink, and then as they're tattooing you, the ink is riding the needle down to the tip. So it's just a gravity-fed system. And then they kind of have like a pool of it that they're working out of. You know what I mean? On your skin. So this works the same way. You're gonna watch. She's gonna put a drop down, and she's basically gonna microneedle that drop in a crosshatch pattern, a circular pattern, and we're talking anywhere from like 0.2 millimeters to at the most maybe 1.5 millimeters. I like it kind of deep because the deeper you go, up to about 2.1 millimeters, you're gonna get better effect. You're gonna
especially
cause
with scarring.
More, yeah, with scarring, like with acne scarring, you're gonna cause more of an effect. And I've already done this a couple of times, and I've seen probably 60% improvement from the first or second one that I did. So I mean, pretty soon I'm going to be at 100%. But 5 years from now, my scars will come back. I will lose the collagen in that area. It's not permanent. Like, I have to do this. Once I get them taken care of. Once they're gone completely, and my skin's totally resurfaced and smooth, I'll probably do it once every 2 years. I'll probably do another one once every 2 years until I hit, say, 40. And then probably do one once a year. Because we're losing 1% of collagen every year. So let's just go out on a limb and say that this gains 1% of collagen. You know what I mean? Like, so you could stay at 0.
Right.
Which would be better than backsliding every year. Because every year I'm losing. Well, if I could just stop losing it, I don't even care about going forward. I just want to stop the loss. And I'm happy with that. You know what I mean? Like, I'm happy aging naturally, then instead of getting to 45 or 50 or 55, and playing catch up. You know what I
Well-
mean? With a bunch of Juvederm and this and that. Not that I'm personally concerned about that, but most
Well,
people.
I know, the other thing is you brought up facelift versus facial, the vampire facelift versus facial. We get this question a lot because people don't understand the difference.
Yeah.
Facelift, you actually mix the PRP with filler. Now you always have the option of not doing filler if you're wanting to go all natural. But you inject a larger amount into areas you want to build up more quickly, such as the cheeks. If you want, fuller cheeks, we inject a bolus of it or a large amount of it into the cheek area, and it kind of kickstarts the whole process. So a lot of people, if they're, already have some collagen loss and, they want more than just maintenance, it's a good way to start it off, because it gives them a little kickoff, a little extra volume. So they're not... Starts the party, exactly. I mean, and then they can do maintenance with facials after that, but we have that question a lot because there's a lot of confusion between this facelift and the facial. And facelift gives you a little more volume in the beginning, and it's a good way to kick off facials to continue the maintenance.
Cool. All right. So we've covered vampire facial. We've covered platelets, right?
Mm-hmm.
All right. We've covered, what else have we covered?
Microneedling.
Microneedling, the general,
No idea.
tattooing. I think that's the best simile of
It is.
microneedling. You know what I mean? It's just instead of using ink, we're using
PRP.
PRP. Platelets.
Right. Which
Okay.
PRP stands for platelet-rich plasma. I don't know if I said that earlier. It's
I don't know, but I'll put it in subtitles.
okay.
Okay, so we covered everything. So anyway, yeah, I'm gonna stop this right here, and we're gonna switch it over to a video, and you guys can see me actually get this done. So let's do it. The process that goes into that. I've already had my blood taken, and then that's my. This is my blood here. Is in this device here that we use. Right. This device. Well, you can tell them about it, Dr. Jen.
Okay. So we took his blood, just normal blood draw. We took one of these syringes at 60 mLs. A lot of people see a syringe this size and they're like, "Whoa, can I take or lose that much blood and still be okay?" Yeah, it's really not that much compared to the amount of blood you have in your body, so you won't even really notice difference. Just drink lots of water if you're having this procedure done, but it's way less than if you give blood. So not a problem giving this. In fact, we even have a kit where you take 2 of these syringes if you're doing what we call our trifecta, which is when you have everything that we offer done with the PRP therapy. So take one of these and we attach it to this little port and put it in this container. Basically this container, it just has this small area and it goes down in here and it just, the blood goes up and you can see the plastic thing right here. It just keeps it capped so blood doesn't go splashing around, because if your blood splashes much, something called hemolysis happens. And if that happens, your platelets think, oh, damage is done now, and they'll activate, and then they'll be no good when we put them in your body. So that's what this is for. And then we take this and we match it with one that looks just like it. We put on a scale to make sure they're the same exact weight, because when we use the centrifuge, which is this machine, it takes your blood and it spins it round and round real fast. But for that to be effective, both sides have to be completely equal in weight. So that's why we use this counterweight with water, and we have to measure it to make sure it's the exact same weight as the blood we just took of yours. So that's it for this part.
All right, what's up, guys? So I'm gonna explain step 2 here. Basically, we've just finished the first round of centrifuging the blood. So what we're doing is we're pulling up the plasma. So that's what this is here. Just the plasma. And then here we've got our red blood cells. Pretty much worthless for this application. So what she's going to do now, she's going to put this plasma into
the second centrifuge device. And what we're going to do basically is try and concentrate it even more. So we've already concentrated it once. That's the concentrated plasma. We're going to concentrate it one more time because we want the strongest buffy coat. We want the highest platelet count. That's the overall main objective here, is a really, really high platelet count, which does the most. It has the most restorative functions. So as far as this is concerned, more is better. And then these numbers aren't random. This is a proprietary technique that comes with the vampire training, and it's all part of that. It's all part of that course. So the times we're centrifuging it for, the amounts, the RPMs, all of that. There's science behind all of that. It's not just, we didn't just come up with that. It's not a random set of applications. So anyway, we're going to centrifuge this down, and we'll check back in with you.
All right, so we're done with our second spin. What we're left with is this clear yellow substance. This is our PRP. I've already aspirated or taken off the top little bit, which is our platelet poor PRP. But what we want, for the face or anywhere we're concentrating on is platelet rich. So you can see the part's clear, and I don't know if you can see on the bottom, but it looks like there's stuff stuck on the bottom. So what I want to do is get that stuff on the bottom loose by gently swirling it without activating the platelets.
Let me see the stuff on the bottom.
Okay. Can you see it?
Yeah. So that's our buffy coat, if anybody's wondering.
Yep.
And that's platelets in the trillions. And we're going to try to basically mix that into the liquid portion that's inside there, right?
Yep, that's what we're doing. Gently swirling it. Because we don't want to activate them. Like I said, once we activate them, they're no good if they're not already in the body. So we're going to do this. I'm going to draw it up in the syringe. And we're going to drip that on his face as we microneedle. And that's when the magic begins.
Cool. I can't wait. Oh, and in between these sessions, while we were doing the centrifuge, while we were waiting for the machine to finish, we went ahead and put this topical anesthetic, that stuff right there. I put some topical anesthetic on. If you want to show everybody that. So it's a lidocaine, benzocaine, tetracaine mixture. It works incredibly well. We put it on the outside of my face, and my whole mouth is numb on the inside. So I can't even believe I can talk right now. My face is so numb. But anyway, I'm glad it works, because that way I don't have to feel any of this. So all the benefits with none of the pain. All right. So welcome back. Basically, what I've got here is the strongest portion of the platelet-rich plasma. So I don't know if you guys can see that there, but anyway, so that's the strongest. That's the strongest portion. It's probably the highest concentrated. So what she's going to do now is we're going to work on this little area right in here where you see my hairline's kind of thinning out a little bit. So anyway, she's going to do that a little bit, and then we're going to move down and we're going to do the whole face. So we're going to do, I've got some acne scarring here. Oh, thank you. Yeah, I've got some acne scarring here on the side, so we're going to try to knock these guys out, and then see if we can't regrow a little bit of hair. So, knock it out, Doc. We'll lay back and relax, hopefully.
It's never bad. I'm gonna have this.
You can turn it up. What was that?
0.4.
I mean, since they turned me away, say anything less than 1. You got one?
We got one.
Yeah, I just feel that barely. It's like I'll explain to everybody what I'm feeling right now. Right now we're determining what depth I can handle. Obviously for hair regrowth, you want to be about 1.5, 1.6. So I can just barely feel these needles that she's doing. But when I say I can just barely feel them, I mean it's like, you know, I've gotten a few tattoos and it's nothing even close to that. So if you've ever had a tattoo, I mean this is like, you know, a tenth of the sensation of that. So,
And obviously he's talking through it.
yeah, it's not, there is that, so.
And I don't know if you can see on the camera, but we have like little pinpoint petechiae or small amount of bleeding right there, and that's exactly what we're looking for, especially for the hair regrowth. So
Yeah, I mean, I can feel it. Just, you know, the further back you go,
a little more.
yeah, I can feel a little bit more the further back. But I mean, my hair loss is only in one specific area, so we don't have to really like fan out too much. You know, we want to really concentrate it in one specific area. So, you know, and my hair has thickened up quite a bit. We did this once before. We did the actual injections first, and it's definitely thickened up. But, you know, you just have to, you know, we recommend like 2 or 3, you know, 2 or 3 treatments. So, I'll actually turn my own thing.
So you want that?
Yeah, that's fine. I'd say probably like I don't know, a 1, 2 maybe, you know. I can actually feel the PRP.
The burn.
Afterward, yeah. It's not the needles that I'm feeling, it's the actual the PRP for sure. Because it's like hanging around on the other side that you already hit, the one that you hit first.
Yeah.
That's what I feel now. You know?
That's what I was talking about a skin knee. That burn you feel comes from the PRP.
Yeah.
And it just kind of burns a little while. And then it goes away. Here, it looks like little petechiae, which is little tiny blood droplets. Watch. You can see it when I rub it with PRP, and I'm just rubbing it in so it gets into all those little microneedle spots. It's completely gone. I mean, there might be a little pinkness here, but it's not like the pictures you see on TV where they're bright red. It's you know, there's no blood left. It's just rubbing in the PRP into the scalp. And the same thing is with the face, which is what you'll see. There's no, you know, red blood oozing out or anything like that. Sorry, you can go ahead now.
So I look normal is what you're saying, so far.
Relatively.
Yeah.
I don't know.
Thanks. So, yeah, so basically what we've done, we finished the hairline area using a stamping pattern with the microneedle, which allows us to go, that allows for the deepest depth to be microneedled in instead of like a moving cross hatching kind of pattern. It's a stamp pattern. So that's going to allow us to drive those needles as deep as possible, which for my hair loss, I don't want to have to do this 5 or 6 times. I want to do it a few times. It's going to be a little bit uncomfortable. You guys were watching me while I was having it done. It doesn't hurt. But I want to be a little bit uncomfortable, get that stuff in there as deep as possible to generate the most hair growth. So now we're going to move on to the actual, we're going to move on to the scars, but we do the entire face because, why do we do the entire face?
Because we want to overall collagen fill. We want to add the volume back to your entire face. But under scarring, we're going to go ahead and do that first because that's why we're going to use this super rich PRP.
Yeah.
And so we're going to do that. We're going to go as deep as we can tolerate at this point too, just for the scarring areas.
Okay. So what we're going to do now is we're going to start working on the face. I guess scars first, right, Don?
Yep.
All right.
Scars first.
Cool. Here, I'll turn that one in. So she's just dripping the platelet-rich plasma, right? And now you're at 1 millimeter,
Yeah.
correct? Yeah. So, I mean, you guys, like, this is, you know, this is real time.
How are you feeling?
I'm fine, yeah, go ahead.
I'm going to go for it.
You know?
Some areas I can feel a tiny little, like a tingle, you know, kind of feels like maybe like ice or something like, you know.
It's more of the
It's,
PRP than the.
yeah, I mean, it's just, you know, because that's mainly what people, they see people go through it and they go, oh my God, like, you know, I'm not doing that, you know. So I figured, yeah. I mean, well, there's other videos out there on YouTube that, you know, they do, but they don't really show. I don't know. I watched a bunch of them, you know, and I couldn't really tell. You know, like no one was talking me through it as they were getting it done. You know, so
Is that,
right now I know that she's really going to work on those scars because I can feel it probably a little bit more. But I mean, I want to get rid of them, you know. So, you know, I'll like cross my finger, you know, deal with it for 30 seconds, and then
a little bit
you know,
further down. Just adjusting it down a bit. Sometimes around the lip can be a little more sensitive. This scar has gone down.
yeah. So this is my dog bite scar, and you guys will be able to see. She'll be working on this.
I need the color. Okay.
Yeah, no, it's fine. And this is a 4K camera, so you know if you guys want to blow this up big and zoom in, you know the resolution should be high enough for you guys to really zoom in and you know see this area, see what's going on in you know detail.
Can you take me out?
Yeah.
Okay.
No, I can take a while. I mean, also my scars, and a lot of people, anybody who's ever had a dog bite or any type of surgery around their lips, you know, it's going to tell you the same thing. Like I could feel little bumps inside my lips, and you know, surprisingly, I still have nerves in there. You know,
Right.
because my whole upper lip is pretty much rebuilt.
Pressure on it now.
So, what was I saying?
Had a dog bite and the nerves and
Yeah.
surprisingly even have them.
So yeah, so I can feel, you know, I have good, you know, the nerves. There was no nerve damage, which was really amazing. But what I was left with was these kind of like lumps inside my lips, and they weren't really visible. But you know, like every teenager at the time I was a teenager, so like every teenager that gets that goes through some type of medical procedure, you know, the doctor tells you what to do,
Yeah.
you know, and you don't do it. Like, and you just, of course,
You're a teenager.
yeah.
You know better.
So what he told me is, he said, massage them for 15 minutes twice a day. I massaged them for 15 minutes once.
Yeah.
That was it, you know.
Sounded about right.
Yeah, one time, that was it. So of course I got these like lumps in my lip, and you know, so this has actually helped to kind of break that scar tissue down, which that's what those were,
I didn't know that.
as I understand. It's like scar tissue or something.
Yeah, that's
there.
scar tissue. I didn't
Yeah.
know that had happened for you.
Yeah.
Very nice.
I've broken down a little bit. And then the actual scar right here that we're working on now was where the skin was fused together. The new skin and I guess the original skin, or this
Yeah.
graft was a skin graft, I guess.
She's the neat and formidable.
Yeah, so there was like a line, and it wasn't real noticeable, but you know, it's
Way less now though.
yeah, it's definitely over the last 2 treatments, it's definitely become you know, like less noticeable, which is really cool. You know, because that's always something that's kind of bothered me. You know, ever since that happened.
Of course.
And a lot of people say like, oh, I can't even see it, but you know,
That's true.
I
didn't
can,
even
I
know.
can, I can see it. You know what I mean?
I'm gonna
I
have
know
you
it's there.
face the camera a little more.
Yeah.
You can see here, you can see the little blood that's coming around. And all I do is, it's almost like slightly washing it with the PRP, sorry. It's also very,
Yeah, it's not like a jelly.
at all.
It looks like jelly when it's in the tube.
And you're like,
It's,
oh.
it's not. It's liquid. It's
Comes
very,
out very easy.
it's very liquid.
And you can see, I mean, he looks rosy, but the little pinpoint blood that was coming out is all gone. So, good results on that side.
So, hey buddy. So, we're totally done with the procedure. I mean, you know, obviously you guys are looking at me right now. You know, probably if I was a girl, I'd probably put on a little makeup. You know, I think the worst, I'd probably look a little sunburn. I mean, what do you think? A little sunburn?
Little sunburn, not even real sunburn though. There's just
little
like
red, right?
Little red.
Yeah.
But you know, you can see where I concentrated here, right here between his eyes, and down here it's a little more red. But those are the areas we concentrated on. But I mean, it's nothing compared to a lot of the other procedures.
Yeah, cool. So anyway, and then you guys, you know, you already saw me, you know, basically get the needle in the face. You know, nothing to it, doesn't hurt. You know, this will be number 3. Number 3. So this is number 3. I've seen my hair thicken up a little bit. I've seen about 60 to 70% scar reduction. So 60 or 70% of my scars pretty much filled out almost completely. So you know, just gonna keep doing it.
Total thing takes, you know, 45 minutes to an hour. A chunk of that is actually spinning the blood that we showed you.
Yeah.
And
Procedure part, the actual needles in the face was like 20 minutes.
yeah,
You know?
yeah. And this is what,
I actually
30
fell
minutes?
asleep. So
This is 30 minutes after?
yeah, about 30. It's been about 30 minutes since the procedure. So if that, 20
Yeah.
minutes after the procedure. I reapplied the rest of the leftover platelets, you know, which is pretty easy. Just kind of dripped it on and you know, patted it in. And we just do that because the holes are still open.
Right.
You know, I mean, you know, for about half hour, I'd say, maybe, you know, you can still get something in there.
Yeah.
So I was just reapplying that stuff, just putting it on like a coating. I just wanted it to be, you know, really soaked in there. And then, yeah, that's pretty much it, you know.
And when
so.
you put it on, it kind of just feels like a mask.
Yeah, my skin's really tight. That's
Oh,
one of the, like, my skin is really, really tight. That's probably the primary feeling right now.
Yeah.
It's really tight. But that's about it. There's no pain. There's no, you know, I'm gonna go have dinner and, you know,
Get his haircut.
yeah, do my
Do
thing.
guys normal things.
Yeah. There's nothing, you know, this unlike, I mean, sometimes, you know, filler, stuff like that, you know, you're gonna have a little bruising or something like that, you know, you might wanna, you know, if I was a girl, I'd probably wear some makeup, but I mean, this, you know, we're here in Florida, like, I just look like I've been on the boat all day, really, you know?
Yeah, probably not
So.
even that bad.
Yeah, right. So, anyway, if you guys have any questions, I'll put up all our information on the, you know, when we shut up. So anyway, if you're interested, give us a call. We do concierge a few days a week, right? A couple days a week.
Yeah.
And then we've got an office on Lake Worth Road, just west of Military, and we have another office up in Northwood. And then we also work out of Michelangelo's Salon out in Wellington. So, you know, just give us a call. You know, we pretty much open 7 days a week. Speak of the devil.
Yeah.
All right.